I'm Dr. John Holcomb. I practice in San Antonio, and I've seen Medicaid patients there for more than 30 years. I'm here today representing the TMA in support of this legislation, which we think will significantly improve our relationship with the Medicaid program. All responsible physicians in the Medicaid program strongly endorse elimination of waste, fraud, and abuse, which injures our patients and our collective reputations. We've heard testimony on another bill today about lack of access to care, and I think everyone is aware of the fact that the TMA has had a great deal of difficulty keeping physicians involved in the Medicaid program, with about only 30% of our membership willing to see new patients under Medicaid at this point. This past year, we convened a special Medicaid conference through the TMA where we had meetings across the state, conference calls, all looking for ways to break down barriers to physician participation in Medicaid. Obviously, rates are always going to be an issue, but sometimes there's nothing that can be done about rates. At the top of every list that we heard of barriers, though, there was concern about the OIG and the lack of due process, the perception of that, the lack of due process in physicians who were accused of Medicaid transgressions. We believe that this legislation is a significant step toward transparency and fairness, which will be welcomed by our members. We specifically note the provisions that require an appropriate notice to the provider of a complaint or a charge, as well as the codification of and delineation of the rights available to them if such a complaint or charge is rendered. And then the further formal appeals outside the commission with clearly defined timelines. We are very encouraged by the requirement for the involvement in the adjudication process of knowledgeable medical and dental directors that will lend the necessary clinical perspective in many issues that in fact do involve a standard of care or practice. This legislation creates a framework for rulemaking that will meet the needs of the state for its required oversight and also for the provider's needs for transparency and clarity in the resolution of accusations and complaints against. The TMA does wish to express its gratitude for all the hard work that's already gone into this effort, and we would specifically like to recognize Senators Nelson, Huffman, and Hinojosa, as well as Representatives Kolar, Sprayman, and all the committees and staff who have done the heavy lifting on this issue. We appreciate your time.